Words I don't know.
Good evening, everyone. Happy Tuesday. It is our monthly Trending Tuesday Live with our CEO and co-founder, Dr. Sophia Yen. So as usual, we will be discussing a trending topic related to reproductive health, tonight being birth control and emergency contraception. We're going to go over all of the ins and outs. So feel free to ask any questions either during the live or after the fact. We'll have one of our patient care advisors get back to you. Other than that, please follow us on social media at Pandia Health. Check out our website. We have lots of great resources on just a lot of reproductive health and birth control information. So without further ado, let's get into tonight's topic. So first question to just kind of introduce everything. What is a little description of birth control and emergency contraception and what makes them different?
So, emergency contraception is a subset of birth control. It just isn't as effective as the regular methods. And that's why the first method of emergency contraception had a brilliant name called Plan B. Plan A is what you do every single day. Plan B is what you do if you messed up. And don't go with the messed up method because it doesn't work as well. So emergency contraception has a range of how well it can work, from 0 to 75 to 95%. And it depends where you are in your cycle. It depends which method of emergency contraception you choose. And the specific example I give is that Plan B and its generics mainly work by blocking the egg from popping out. And so if your egg has already popped out, aka ovulation, aka 14 days after the first day of your last period, then Plan B and its generics and a lot of emergency contraception is not going to work for you. So the 4 forms of emergency contraception are: you can use an IUD, either the copper or the hormonal. I like the hormonal because if you keep it in, it works for 5 to 7 years. And then for the copper, it works for 10 years. But the main side effects of the copper IUD: more blood, more cramps. So make sure you don't say, I didn't know, because I'm telling you now, more blood, more cramps. And then it works 99.99999% of the time within 5 days of your contraceptive accident. But it requires you go somewhere and somebody sticks something in your uterus. And so 1, that person has to be trained to do it. 2, your insurance has to cover it, though under the Affordable Care Act. If you have insurance, it should be covered. And that's the IUD. And then the second method is Ella, a prescription emergency contraception. That beats Plan B and its generics in its effectiveness at every time point. So if it was me, my daughter, my friend, my patient, I would recommend Ella. And again, thanks to the Affordable Care Act, if you have insurance, no copay, no deductible, aka free, if your doctor writes the prescription for Ella. So that's what I would use if I wasn't going to use the IUD, or my doctor. And then the third one is Plan B and its generic. So if you want to use the third most effective out of 4 methods, go ahead, use Plan B and its generics. The huge limitation there, because there's a big push, it's over the counter, so it's very easy to get. But the negative there is if your body mass index is 26 or greater, it doesn't work at all. It's as good as if you drink a glass of water, which drinking a glass of water does not prevent pregnancy, or eating a Tic Tac, that does not prevent pregnancy, or jumping upside down or swimming in a pool or whatever. None of that prevents pregnancy. So I'm just hearing feedback, sorry. And so that's Plan B and its generics. Please check your BMI if you're going to use that method, and make sure your BMI is not 26 or greater, because my BMI is 25, and thanks to Thanksgiving and a lot of dessert, it might be 26. So, and then the last method is called the Yzp Method, which is take 4 birth control pills now in 4 and 12 hours. It is the least effective. It has nausea. It has side effects. So I wouldn't use it unless I had nothing else and all I had was a pack of pills. And even then, you have to check if it has levonorgestrel or norgestrel, because those are the only ones that'll work. So if you're on norgestimide, desogestrel, norethindrone, those ones, then it's not going to work for you. So you can Google it, Yzp Method, check what pill. And then sometimes if there's 3 different colors, you can only use this color pill, blah, blah, blah. It's very complicated. But it's there if you need it on the internet, and I trust Planned Parenthood.
Cool. So in terms of accessing Ella, what is the best way to go about that instead of having to go to your pharmacy for Plan B? It's also $50. So just something else to keep in mind.
Yes. So the key with getting Ella is at Pandia Health. We always, when we write a birth control prescription, pill patch ring, or like, do you want some Ella with that in case of an emergency? So it's nice to have emergency contraception sitting in the corner in case of emergency. So you're not like, does your pharmacy have it? Does my insurance cover it? Can I get to the pharmacy right now? As I like to tell people, if the condom pops at 3 a.m. and you're not using any method and you want to prevent unplanned pregnancy, I want that emergency contraception in your mouth at 3:10. I do not want any cuddling, huddling, waiting till the morning after because you heard the morning after pill, or waiting till 5 days after because you did hear me say you could wait to 5 days out, but it's not going to work as well. Every hour you wait of taking your emergency contraception, so let's say it broke at 3 a.m. and you waited till 4 or 5 or 6 or 8 or whatever, every hour you wait doubles your chance of pregnancy. So take it as soon as possible. You have up to 5 days. And if your friend comes up to you on day 3 or 4 and is like, I was sexually assaulted 3 or 4 days ago, you're like, here, sister, if you don't want to get pregnant, take this. But for you, because you heard my talk, 10 minutes later, please. Or you can contact Pandia Health. We can write the prescription. As long as we're writing the prescription for emergency contraception, we would like to write you the prescription for the birth control pill patch ring so that you don't need emergency contraception in the future if you're using a regular form of birth control. Or you can call up your doctor. If you have a doctor, you'd be like, I need emergency contraception. And I heard if you call in Ella that it's free under the Affordable Care Act. And the doctor will be like, okay. And if they say, how about plan B? And then you say, it's less effective. And if my BMI is 26 or greater, it won't work. And if I get pregnant, I'm going to sue you. And then your doctor will be like, okay, I'll write for Ella.
Perfect. That brings me actually to a different question that I kind of just thought of after what you just said. So if you are taking birth control, so if you're on any birth control, pill, patch ring, IUD, anything else, is it still safe to take plan B? And what is a scenario in which, actually, I'm not going to say plan B, emergency contraception, is it still safe to take it? And what is a scenario when you're on birth control, but you should maybe still consider the emergency contraception?
Yeah. So if you're taking your regular hormonal or copper IUD birth control, you don't need emergency contraception. I know some people are like, really don't want to get pregnant. And so they're like, I'm going to use the pill plus emergency contraception. And that's just crazy talk, waste of money, too much hormones. If I want to be safe, I would use condoms plus hormone, but using 2 hormonal methods just is not a good situation. The question that we talked about on the previous one that was brilliant is when would you need it, which is a brilliant question, is if you miss your birth control 3 days in a row and your pill, your patch, your ring, and you haven't had 21 days of active pills before then. Because if you've had 21 days of active pills, patch, or ring before, and then you miss 3 days in a row, that's just like your week off when you want to bleed, if you want to bleed. But if it's less than that, then you're not covered and an egg might pop out, ovulation. And that is the concern. And that's when you would want to take emergency contraception. The follow-up question is, if you take emergency contraception, when do you restart your pill, patch, ring? And if you do use plan B or it's generics, you can restart immediately. For Ella, we put on the thing, and I forgot to emphasize, if you take Ella, do not take the pill, patch, ring for 5 days after taking it, because the way Ella works is the anti-progesterone. And the pill, patch, ring have progesterone. So if you take this and it's an anti-progesterone and you throw progesterone at it, Ella's not going to work. So that if you take Ella, wait 5 days. And most of us, when we're taking emergency contraception, we like to see the bleed because that means we're not pregnant. And so by not taking your hormones for 5 days, you will get a bleed and you'll be like, oh, thank goodness I'm not pregnant.
Okay, cool. I didn't know that about plan B versus Ella. So plan B, you can still take your birth control right after, but Ella, you should wait the 5 days. That makes sense too, because it is nice in this one occasion to bleed because, right, you'll know, all right, not pregnant, check, great. So brings me to my next question. For birth control and emergency contraception, what are the main side effects? And is there any instance in which someone shouldn't take it?
So for emergency contraception, Plan B and its generics are over the counter because there is no contraindication unless you are allergic to levonorgestrel. And I have never met anyone who's allergic to levonorgestrel. They might have been allergic to a birth control pill that had levonorgestrel, but it was the coloring. because different levonorgestrel pills, one has red, one has green, one has yellow, and it was probably the coloring and not the hormone itself. And that's why it's over the counter, because there really is no contraindication for it. Ella, same thing. The main contraindication for both of those is if you're pregnant, but mainly because it won't work. It won't do anything to what's growing, but it's a waste of money and time and on your body for no good reason. The birth control, there's so many different birth controls, and each method has its own side effects. The pill, the patch, the ring, 95% of women that go on it don't have any side effects. And particularly at Pandia Health, we specialize in birth control. I've written 2,000 birth control prescriptions over 2 years, looked at the side effects by race, ethnicity. We take in consideration your age and your BMI. So we believe we have the secret formula to give you a good pill that has the least amount of side effects so that you'll stay on it. And so you shouldn't get many side effects. Some women notice in general on birth control, their breasts might go up a half a cup size. So if you were almost A cup, you become an A cup. If you're A cup, maybe you go to B cup or something like that. Any birth control, theoretically, if every single month it triggers without birth control acne, then if you go on smooth hormones, the acne goes away. There are 40 different pills. So if one doesn't work, there's 39 others, or at the very least, there's 8 different progesterones. Know the one that you tried and didn't like and tell us. And that way we can try the other 7 for you.
Yes, I remember reading about how a lot of the time people are actually allergic to the coloring in birth control, and that's why people will sometimes think like, "Oh, I can't take the generic because of that." We have a whole article on it, by the way. I can link it in the comments. But yeah, so in general, usually, first of all, generic is typically just as good, and if you are allergic, right, a lot of the times it can be the coloring, and it's okay to talk to your doctor. It's necessary to speak to your doctor about that. Doesn't mean birth control isn't right for you. It just means you might need something else. And say the pill isn't great for you and you consistently miss your pill, there's the IUD, the implant, the ring, all of that. With the IUD and the implant specifically, set it and forget it. So of course, all great options. But yay, okay, this is so helpful. So my next question, kind of going along the same lines, there's definitely, I would say, a big thought process surrounding the idea that birth control and emergency contraception can impact your fertility. So what is the correct information on that?
So my favorite joke is, yes, it makes you infertile while you're taking it. That's why you're taking it. You're using it as birth control for those that are using it for birth control. But the pill, the patch, the ring is out of your body within 3 days. At the very least, at the most, a week, it's out of your body. But at 3 days, and the way we know this is those people that are continuously taking it, trying to avoid bleeds, if you stop your pill, patch, ring for 3 days, you will bleed on day 3 because the hormones have fallen and washed out of your body. Same thing with emergency contraception. The Plan B in its generics is a very high dose of levonorgestrel, aka progesterone. And so it's like, and your body's like, I'm pregnant. Why would I want to pop out another egg? And it is gone out of your body within 2 to 3 days. Same thing with Ella. You just got to look at drugs and their half-life, and within 2 to 3 half-lives, they've washed out to 0. So they do not make you infertile after you stop the medication for 3 to 7 days.
It's a very important point to touch upon. I feel like that's such a common misconception that people think it's going to make them not be able to have children. And yes, while you're taking it. But usually that's the goal in a lot of cases. That being said, birth control can be taken not just for preventing pregnancy, but also reducing severity of periods. There are 3 specifics. Is it 3 or 4 that are actually beneficial for acne?
So there have been like 2 or 3 that are approved for acne, but that's just because they wasted their money or spent the money to get FDA approval. But the research has shown any birth control pill makes your acne better if your acne is triggered by the up and down. We've learned that some of them have maybe more acne side effects and some of them are better for acne. I'd say there's like 4 of them that are better for acne. One of them is better for acne, but not good if you want to skip your monthly bleed. Another one is good for both skipping monthly bleed and acne. Another one is also good for both, but then you have to be able to drink 8 glasses of water a day. And if you have any underlying kidney problem, it could bring it out. So everything has its risk benefits. And by choosing a birth control expert company and doctor such as ours, we know this stuff. Whereas Joe Blow rando doctor has so much stuff to know. They have to know hypertension, diabetes, stroke, heart attack, and birth control. But all we do is birth control. And that's why we apply our smart academic lens, what we've learned from writing 2,000 birth control prescriptions in 2 years, to make sure you have the least amount of side effects possible.
I also like to mention too, whenever I talk to others about Pandia, is that we're doctor-led and we're women-led. So of course we have all of the knowledge from you and our other doctors on our team, expert care, expert doctors, but majority of us are also women and people with uteri. So of course we have that personal experience too. We know what it feels like to have that fear of running out of birth control or having that fear of possibly getting pregnant, because of course accidents happen. So I like to mention that too, like, we're on your side. And something you always say that I like is that you'll always give someone what's best for them, even if it doesn't impact our bottom line. It's all about the patient. So
I am the only CEO in birth control delivery that has taken the Hippocratic Oath, which is do no harm. And exactly as you said, Sarah, we will always tell you what's best for your health, even if I can't make a profit off of it, because I don't need to make a profit off of pushing something that is not scientifically proven or that is not safe for you or that you don't need.
yes, exactly. And I love that about our company. It's awesome. So I got one more question and then a quick little scenario. So for the question, you kind of touched upon this, but we'll just review it one more time. How does birth control and emergency contraception affect your period?
So they can have similar effects. Mainly, let's do emergency contraception. The copper IUD has its own special side effects, which is more pain, more blood. The hormonal IUD is lighter periods, but in general, emergency contraception can make your period come early, can make your period come late. The ones where you put hormone and then you withdraw them, usually it'll come. But if it doesn't come, it still could have worked. It depends where you were in your cycle. If you were about to pop an egg and you throw this stuff down, it's going to go one way. If your egg already came out, it's going to go another way. If you were about to bleed anyway and it just tipped you over or it scared you and held it off. So we haven't studied that as physicians, like the different things, because we're like, just take it as soon as possible and let's prevent unplanned pregnancies. But it's something, if anybody wants to do research, you could go and do. With the birth control pill patch ring, they make all your periods lighter. If you normally bleed 5 days a week, it usually goes down to 3. If you're using 5 tampons or maxi pads a day, it goes down to 3, because you're not building the lining of the uterus to a level, what I call 10 thickness, to catch an embryo. You're just taking it to 1 or 2. And so when the time comes to have a withdrawal bleed, it's not even a period or a menstruation. We call it a withdrawal bleed. You took away the hormone and then you bled. It only bleeds a little bit because you didn't build it to 10 thick to catch an embryo. With the IUD with hormone and the implant, they thin the lining to like level 1 or 2. So if you do bleed again, very little bleed. 30% of those with the implant and the IUD lose their periods, and 70% get lighter. With the shot, I told patients, and I counseled them really well, you could bleed every single day for like 6 weeks to 3 months. But I forgot to tell them, if you bleed longer than a week, please tell your doctor. There are things we can throw on to make you not bleed longer than that. So the difference is, one will definitely whack out your period. The other one, actually, the pill patch ring gives you control of your period. Once you're on the pill patch ring, you can decide if you want to bleed every month, every 3 months, or never. I haven't bled for 12 years as long as I take my medication, and it is a lovely thing. One caveat with the patch, you can't go longer than 12 weeks in a row with not bleeding because the estrogen builds up. And so you need to come off for a week, clear things out, and then you can go another 12 weeks. That's the only difference on the patch.
Yeah, speaking of which, we have a collab with Torla, which is under Agile Therapeutics. We have another live actually with them. Go check that out. So if you're interested in the patch, we are actually prescribing that as well. So, thanks for the question, Susanna. We'll go over that next. I wanted to mention something about birth control. I don't remember, but we'll go over this question. So, how do you know which birth control is best for you? Great question.
So, the key to choosing a method of birth control is to know what you're comfortable with. And are you comfortable touching yourself? Because if you're not comfortable touching your vagina, then the vaginal ring may not be a good method for you. But it's a pretty cool method. So maybe you try to get used to your vagina. But if like the thought of sticking your finger up your vagina and pulling out the ring or putting up the ring, then the ring is not for you. In the paradigm of birth control counseling, our new paradigm is start with the best and work our way down. And you tell me why you don't want the best. So the best, most effective, other than, abstinence 100%, but abstinence doesn't work when you promise to be abstinent and it doesn't work. But the IUD and the implant actually beat tubal ligation, which is crazy, where you snip, and permanent sterilization of a woman. But the IUD with hormone and the implant beat that. And the thing with that one is you have to be comfortable somebody sticking something in your uterus and it's sitting there, or have the ability to get to a doctor. I think like 70% of counties don't have a doctor that feels comfortable putting an IUD. The implant, you have to be comfortable having something in your arm. What if your mom happens to see it or something? It's pretty invisible, but it just depends. Some people's skin are thinner and you can see things like my skin. You can see all the veins. So you'd probably be able to see the implant if I put in the implant. The shot is, if you can get to a doctor's office every 3 months, then the shot is something. And if you're not afraid of needles, right? I have some patients that are deadly ill, afraid of needles, the shot is not good for them. The ring, as we talked about, you have to be comfortable touching yourself. The patch is pretty awesome. You just put it on your arm. They don't want it anywhere near the breast, so you cannot put it on the breast. You cannot put it on the inside of the breast, not because it causes breast cancer, but that's where breast cancer happens. And if you happen to get breast cancer, they don't want you to blame them. And the Twirla patch I like because in the other patches have a very high dose of estrogen, not the dose itself, but when we check the blood level, it was a very high dose estrogen, and that increases your risk of blood clots and whatnot. But Twirla was specifically formulated to have a normal dose of estrogen, good enough for your bone and not high enough to give you blood clots, just like a pill, like a 30 microgram pill. So that's great. And then the pills, the main benefit of the pill is that there's 40 different types. So if you don't like one, you got 39 other options. Whereas with the patch, if you don't like Twirla, then you have to use those other ones, which have high hormones. With the implant, there's only one form. With the IUD, there's only levonorgestrel. There's different dosages of it, but I wouldn't play with that. I just, either you like levonorgestrel as an IUD or you don't. So, important. Those are all your options. I've talked you through it, but if you have more questions, please talk to your doctor or your provider. We're here to deliver.
Yes, we are here to deliver, right? You want to first go to your own doctor and then we'll take care of the rest. We actually got 3 awesome questions. So I'm going to go to Susanna's first, just because it kind of relates to what we were just talking about, and then we'll go back. So is the ring affordable if you don't have insurance?
I would say no, because the ring is $150 a month. The birth control pill, if you are okay with the generic, is $15 per pack of pills. If you're bleeding every month, then that's 13 packs a year, because it's not perfectly 12 times 28 days. Or if you're skipping, then you're going to need 17 packs a year. But for the price of one ring, you can get 10 months of birth control pills.
Yeah, no, that's a good question. The you can use Medicaid too. I know that we have an
Yes,
article
if you have insurance, any FDA approved form of birth control should be available with no copay, no deductible. So when you're choose what works best for you. But if you want to do cost effectiveness, the pill is pretty good cost effectiveness. The patch is pretty good cost effectiveness, because if you're going to forget to take the pill, better something that you only have to change once a week and therefore prevent unplanned pregnancy.
Exactly. Yeah. No, absolutely. We got another question. So in terms of Depoprovera, that's the shot, correct?
Mm-hmm.
Okay, perfect. So if you take a break from that, is it safe to go back on it? And when/if should you take a break?
So the main concern with Depoprovera was that it's bad for your bone density. So we are building our bone density, those of us who have uteri, from age 15 to 30. And once you're 30 and above, all bets are off. I mean, you don't build anymore. And so the Depoprovera thing is not so much of a concern. What's cool about Depoprovera is they've shown if you come off of it, after 3 years, your bone density becomes the same as if you'd never been on it. So maybe I would come off of it at 27 and build my bone density back up so that I could catch up at 30. But I would say there's no need to come off Depoprovera other than this bone density concern.
And I guess also
same thing with the pill, the patch, the ring.
Oh yes, I was gonna say also if you want to have kids, then you need
Yes. If you want to have kids and come off of it, the one negative of Depoprovera is generally after 3 shots, it could take 6 months to a year for it to wash out of your body because it is stored in your fat. And so it can be stored in your fat. And so therefore it may take a while to wash out. But the pill, the patch, the ring, the IUD, the implant, all rinse out as soon as within 3 days to a week after removing it from your body, both by not taking it or removing it physically.
Yeah. And say there is an issue with your pill, patch, or ring, you can just take it off, right? There's no weaning off period or anything. So say it's making you really sick or you're feeling sick for whatever reason, you maybe think it's the birth control, you can just stop it.
The only reason I would not stop it is if you'd had sex within the past 3 to 5 days and you want to prevent pregnancy from that, because sperm can hang out for 5 days. So if you stop it today and then the egg pops out and that sperm's still hanging there, or you got super sperm, then you can get pregnant. So, but otherwise, if you're not having sex within the past 5 days and you're having horrible side effects, just stop it.
Mm-hmm. And it sounds really stressful, but I would say the best way to not be stressed about it is to just set yourself a schedule. If you're on things that you have to change regularly, just make sure you're on a routine. And I mean, I've been on it for 5 years and I've missed 1 day, I think. So knock on wood, but I'm pretty routine. And it's been not stressful for me. Again, knock on wood, but yeah. So it's possible to kind of develop that and make your life easier.
And I think a lot of people have gotten used to taking a vitamin every day, which is a very healthy practice if you don't eat a full balanced meal just to catch any vitamins you miss. And so if you were trained, we're training our children to take calcium every day because we suck at taking calcium by milk, then they're used to taking something, actually 2 or 3 times a day. And so just adding 1 to the routine is no big deal. Or many of us brush our teeth, or even if you don't, you could actually put the pills right by your bedside with a bottle of water. So as long as you turn off the light before you go to bed, you take the pill, then you're good.
Perfect. We got one more question. I actually think this is like a perfect way to wrap up. This is from Shumail. Also, shout out to her. She's on our social media team. She's killing it with our graphics. So thank you for that. She has a great question. So her daughter is 17 and has really painful periods. She was wondering if birth control could be a good solution for that and if there's an age limit.
Yes. So my passion is educating anybody with a uterus that the only reason we bleed every single month is we build that lining and we're like, embryo? No embryo, bleed. And then we do this every single month from age 12 and a half on average in the United States until 50. And if we're only trying to pop out 2 kids on average in the United States, why are we doing this 350 to 400 times in our lives? When if I just done it when I want to get pregnant, it only took me 3 months to get pregnant each time. And I'd been on the pill for 10, 20 years ahead of time. Just, tip for all of you out there, it's fine to be on the pill for that long and then pop out 2 babies. Then why are we bleeding every month? And the number one cause of missed school and work under the age of 25 is heavy or painful periods. So if you're missing school or work, please see a doctor. And unfortunately, a lot of doctors are afraid of birth control, even though the American College of Obstetrics and Gynecology has said it's safe and it should be over the counter. But if your doctor won't write it, that's what Pandia Health is here for. The minimum age for birth control, not for birth control, but hormonal treatment to treat horrible periods that you are missing school, possibly due to endometriosis, most likely, or due to polycystic ovarian syndrome or something that runs in the family. You could start it as soon as your periods start. In general, as an adolescent medicine specialist, board certified, I recommend waiting 2 years after your first period, mainly because if you start an estrogen containing product before 2 years after their first period, they could lose a potential inch or 2 inches because you're still growing an extra inch or 2 after that first period. But conversely, you're also going to stop growing 2 years after that first period. Then we can throw on that estrogen. But if you're missing school or work, then it's fine if you're an inch short of what you were going to be,
Mm-hmm. To mention what you said too about how it's not even always just for the pregnancy prevention, it's just like the hormonal regulation, which is really nice. I think if you are a younger person talking to your parents about it, I think that's a good way to kind of bring it up. I know my uncle, who's a doctor, says he calls it that until his kids are married and then it's birth
Yes.
control. But
Yes.
before that, it's just, I don't want to know, hormonal regulation. It's, make your periods later or disappear.
And I pitch it as a tiger mom, you know, mom to mom. My kid's going to crush your kid on the SAT because my
Mm.
kid won't have a 1 in 4 chance of being randomly hit by blood in the middle of the SAT. Or my kid won't be like in the middle of the SAT. My kid will be focused on the SAT. My kid will be focused on her finals. My kid will be marching band without as she go down. And certainly some people don't feel their periods at all. Power to you. But for anybody who's suffering that missing school and work, please see a doctor. We have the technology to make it such that you are functional in society and such that you can excel over those who are randomly hit by blood 1 week out of 4.
It's true. No, it makes you, it's, we want to empower you to be able to have that autonomy over your own body. It's really cool. I think a lot of the time women feel very suppressed in that aspect, but we don't have to be. So it's a really cool thing, and I love that Dr. Yen is very passionate about that. We have a lot of featured articles in other magazines. Like we just had one in Refinery 29. I saw that one today in her campus. So we have a lot of information about it. If you're interested, you could check out our website. So before we wrap up, I just wanted to ask if you had any final takeaways, anything like that.
One thing I want to put out there is we want people to think about emergency contraception like a fire extinguisher. You want it sitting in the corner in case of emergency. And that's why at Pandia Health, when we write it with your birth control, because we're like, maybe you're going to miss a pill, a patch, or ring, you're going to run out, who knows what. Or God forbid, one of your friends is sexually assaulted, then you can be like, here you go. And deal with the insurance or the pharmacy being difficult or can't get the medication. Though, of course, if you use Pandia, we'll make sure you get your stuff. But if you're using your local pharmacy, the pharmacist may be confused and think that Plan B or Ella are abortifacients when they are not. If you have a positive pregnancy test and you take Plan B and its generics, or Ella, it's going to do nothing to the growing pregnancy. It's just a waste of time and money. So know that they are not an abortifacient. And it's actually really important given the politics that's happening in the United States. I had a lot of friends ping me and they're like, oh my goodness, they're outlawing abortion pills in Texas. How does this affect your company? And I was like, it doesn't. Because we don't do abortion pills. We are about prevention of unplanned pregnancy. We are also about women's empowerment. And so if you do need an abortion pill, you have a positive pregnancy test, please check out plancpills.org, or you can always trust Planned Parenthood, and as well as the National Abortion Federation. Those are good resources.
Yes, check those out before anything else. You don't know what you'll find. Sometimes you get to more of an anti-abortion website. So definitely,
it's called Crisis Pregnancy Center, but they've dropped the word crisis, just pregnancy center. They're Women's Pregnancy Center. It sounds all good, but then you go in and they tell you lies about abortion, how abortion will make you take drugs or it will make you sterile, and that's not true. So make sure you find a trusted healthcare provider if that is your need. But for Pandia Health, we're here to prevent unplanned pregnancy. We're also here to make #periods optional. And very soon we'll be launching acne and menopause in the future.
Yes, I'm so excited because the American Girl doll book that I got for my puberty did not talk about menopause, so I have no idea how to tackle that. So I'm excited. Definitely will be sharing that with my parents and their friends as well. So, and acne too. I mean, everyone can benefit from that, honestly. So, well, this was awesome. If anyone else has any questions, feel free to just leave them in the comments and we'll get back to you as soon as possible. Otherwise, thank you all so much for watching. This was great. As always, I learned so much. So thank you, Dr. Yen. Don't forget to follow us on social media. We're actually really trying to increase our presence. So would love to have some shout outs, give some shout outs, all of that. So definitely
tag all your friends. Please follow us on TikTok. We need to get above 1,000.
Yes, we really do. And also, we're having a giveaway right now. So if you go to our last post on Instagram, like, comment, and tag 3 friends, you will be entered into a raffle for a Macy's gift card. So holiday shopping, who doesn't need that? But anyway, have a great night, everyone. Thank you so much for watching, and we will be back soon, probably next month, but we'll see. Have a good night.
Definitely.